Hi everyone, thanks for listening to my presentations. Today I'll be talking on hyperthyroidism by limiting myself to symptoms and signs. And this will form part 2 of 7. Yeah, and if you haven't listened to part 1 of 7 when it comes to this series, please kindly do, because that is all about hyperthyroidism causes and how to make the diagnosis. With that, let's go. I'll start with adrenergic symptoms because this is what most of us will be looking for when it comes to hyperthyroidism, right? Palpitations. Patient complains that the heart is racing, tachycardia on physical examination when you take the vital signs, tremor on examination, and anxiety, part of the history, and of course, heat intolerance, part of the history. Graves' disease. Graves' disease is the commonest cause of hyperthyroidism. You're going to find this if you check part 1 of this series. And if the cause is Graves' disease, like it should be expected in most cases of hyperthyroidism, we'll be dealing with Graves' ophthalmopathy. In the course of this presentation, I will explain further when it comes to Graves' ophthalmopathy. I might be dealing with infiltrative dermopathy. In that case, you'll find localized or peritibial mesoedema. You can also find that in Hashimoto's thyroiditis as well. You can find diffuse goiter. All these will give you a clue you are dealing with Graves' disease. Some in medicine believe that you can actually see the entire system through the hand. In other words, the hand is the window to the body. If you don't believe it, kindly follow me. In medicine, where we check the hand, we are looking for many things going on in the system. In hyperthyroidism, checking the hand could be warm and erythematous, could be having sweaty palms and onycholysis, otherwise known as plumas nails. In that case, there will be separation of nail from the nail bed, and we will know we are dealing with hyperthyroidism. And when you check the nails again, the nails could be thinning out. So, looking at the hands, for the features of hyperthyroidism, the nails, and sweating palms, and warm and erythematous, hand, palm, dorsum, you are pointing to hyperthyroidism. Dermatology. There's likelihood of hyperpigmentation in hyperthyroidism. Pruritus or hips, that may be taking us to autoimmune disease, particularly Graves' disease. Vitiligo. Of course, vitiligo and alopecia areata will all be pointing to autoimmune condition. And I will not be tired to repeat that once you pick an autoimmune condition, please look out for the rest. So the skin could be the window to knowing autoimmune diseases in many people. Vitiligo alone is a dermatology problem, right? But from that, we can pick hyperthyroidism, we can pick type 1 diabetes mellitus, systemic lupus erythematosus, Sjögren's syndrome, celiac disease, ulcerative colitis, Crohn's disease, and the list goes on. Facial or ocular. Like the Graves of ophthalmopathy, we're going to find stare, lid-like, exophthalmos, periorbital edema, conjunctival edema, gritty feelings in the eyes will be part of the history, pain in the eyes will be part of the history, and of course diplopia. So again, looking at the face and taking history related to the face or the head region, you can pick the diagnosis of hyperthyroidism. Cardiovascular system. we're going to be faced with increased cardiac output, increased heart rate, increased blood pressure, particularly the systolic, and we may be dealing with isolated systolic hypertension here. We might have high output heart failure, atrial fibrillation is possible. MVP, I'm not talking about most valuable player, no. I'm talking about mitral valve prolapse with mitral regurgitation. And of course, increased thrombosis, giving us what? Myocardial infarction. So, hyperthyroidism could present with all these when it comes to cardiovascular system. In musculoskeletal system, we can be dealing with increased bone reabsorption, increased calcium, and somebody will be shocked. So hypercalcemia from hyperthyroidism, increased osteoporosis. So in a woman postmenopausal, now having hyperthyroidism, so I have a big job at hand, right? Yes, you do. Increased fracture, of course, needless to say, when you have increased osteoporosis. What do we expect? Acropathy, that is finger clubbing, is very possible. Lipid and diabetes mellitus. In lipid, hyperthyroidism will alter some stuff, giving us decreased total serum lipid, giving us low level of high density lipoprotein and low level of low density lipoprotein with low total cholesterol. Somebody will say, yes, it's all good, everything is low. No. In cardiology, the cardiologist or future cardiologists, no, medical students or residents will not be happy to see high density lipoprotein being low. The rest will be good, right? But we want HDL to be high. Hyperglycemia. Why that? Antagonism to the peripheral action of insulin will likely occur here. And if that is the case, that is peripheral resistance. And we'll be dealing with type 2 diabetes mellitus. Respiratory system. You want to ask me what has hyperthyroidism got to do with the respiratory system? Whole lot. Shortness of breath. Exacerbation of asthmatic attack in individuals with history of asthma is likely. In other words, someone had been diagnosed with asthma maybe from childhood or middle age, but now getting old and now having hyperthyroidism, and suddenly he or she is having repeated attacks more than the rest, and somebody is wondering somewhere. Well, stop wondering. Treat that hyperthyroidism first. Then you can rule out other possible causes of the exacerbation. Pulmonary hypertension. And of course, the medication you are going to give can even worsen this also. And increased thrombosis that will likely lead to pulmonary embolism. Okay, gastrointestinal tract. Yeah, there we go. Increased metabolism because of hyperthyroidism will lead to unintentional decrease in weight. And of course, in hypothyroidism, if you check my channel, everything is low in them, but we're dealing with hypothyroidism where everything will be high. Here, there's possibility of malabsorption because there is increased gut motility. Of course, that will lead to steatorrhea, right? And celiac disease is possible in the face of Graves' disease. Remember, I've said it. Graves' disease is the commonest cause of hyperthyroidism. And I've also said it, that when you pick one autoimmune disease, you better don't deceive yourself. you might have one or even more than one more autoimmune diseases. The individual will have good appetite or actually an increased appetite, but not gaining weight. Why that? Increased metabolism or even diarrhea. But there are two sets of people here. Hyperphagia, with or without enough appetite, will lead to weight gain in younger patients. Then you ask me, what will happen to older patients? That won't happen in older patients because in addition to all these things I've been saying, they can have anorexia. So in older patients, they will have increased metabolism, malabsorption, with or without celiac disease, they will have anorexia. And they will have more unintentional weight loss compared to younger patients. And of course, diarrhea, opposite of constipation and hypothyroidism. Anemia could be secondary to persistent vomiting in people with hypothyroidism or pernicious anemia, which is another autoimmune disease, because the common cause of hypothyroidism is Graves' disease, which is an autoimmune disease. And when you have one, you can have more. And you will likely pick normochromic normocytic anemia, the future of anemia of chronic disease. Compression effect. You can find compression effect only when you have goiter creating that. And that will lead to dysphagia, particularly thymic enlargement that could be picked as an accidental discovery when you are carrying out your investigation. So somebody, an elderly man that is about 60 years or 65 years, has come down with dysphagia. Part of the differential diagnosis could be goiter. Reproductive system. In females, we could be dealing with anovular infertility. The individual is menstruating every month, but there's no release of oocytes. In men, we might be dealing with gynecomastia. Why that? Because there is the possibility of increased conversion of testosterone to estradiol. Okay? And we might be dealing with decreased libido or erectile dysfunction from increased estrogen. Remember, I said something like this when I was handling hypothyroidism as well. You can check that out. Renal system. Someone is saying, oh my goodness, so is it going to cover all the systems of the body? Yes, that's it. I have put all the clinical signs and symptoms in such a way that each system is addressed. In renal system, hyperthyroidism can lead to increased urinary frequency or nocturia. If care is not taken, someone who has not been bedwetting before, but because of hyperthyroidism, suddenly he or she is bedwetting, don't blame him or her. Treat the thyroid pathology. Psych. Someone is asking me, really? You want to link these to psychiatric disorder? Oh yes. There's possibility of psychosis, agitation, depression. Remember, there's depression in hypothyroidism also. Now we are talking about hypothyroidism. We are still talking about depression, anxiety, irritability, liver emotions, cognitive impairment, and of course palpitation. So if you are dealing with an elderly man or woman with features of dementia, it is not out of place to rule out thyroid pathology. Run thyroid function test. It might be hypothyroidism, and you treat, and he or she is fine. Nervous system. Yeah. Tremor, periodic paralysis of thyrotoxicosis, muscle weakness. Elderly could present with apathetic symptoms. Apathy. Okay. Goiter. The goiter, that is the swelling or enlargement of the thyroid gland, could be toxic mononodular goiter, particularly in older patients with Graves' disease. SSSS, if you like, fill in anyhow, but I meant sick sinus syndrome. Those students of cardiology will grab that immediately. Sick sinus syndrome is common in elderly people. So if an elderly man is not having tachycardia, it may be due to an underlying sick sinus. Remember, if you want me to explain further in a bit, between the junction of superior vena cava and the right atrium is where we have sinoatrial node. Like all other tissues could undergo degeneration in older people, that sinus node could also undergo degeneration in older people. And that is why many elderly men and women will present with bradycardia when they are dealing with sick sinus syndrome. So if this is hyperthyroidism from thyroid function tests and all other signs and symptoms, and you are not picking tachycardia in this elderly man or woman, no, don't be baffled. You might be dealing with underlying sick sinus syndrome because of degeneration. Okay, on physical examination, I will present a separate video on this later on, not right now. So we're going to have general physical examination done, from walking into the clinic to interaction, from language, from everything. And of course, psychosis, physical appearance should be examined, groomed or not, dressing appropriate for the season or not, speech congruency or not, mood, labor or not, depressed or not. And of course, we'll take our vital signs. That's what will give us whether we're dealing with systolic hypertension, tachycardia or not. Even from there, we can get atrial fibrillation with irregular, fast beats. We check the head and neck for what? For features, facial expressions, the stare, lead lag, exothymos, and everything. And then the neck region anterior for enlargement of the thyroid gland called goiter. Of course, the respiratory system, cardiovascular, gastrointestinal, and full neuro. Don't worry. Continue to be a faithful follower of this channel. I will be producing videos on physical examination later on, giving details of all this. Still on physical examination, I have to check the skin, check the hand, weigh the patient. How about the gaits, the motor system, the sensory, the reflexes? And when you check the hand, like I've said earlier, from the hand, you can see through the entire system in the body. So the hand will serve as the window to the entire system of the patient. So finger clubbing, either warm or sweaty, could see anemia in form of pallor, onycholysis, check the nail bed and the nail. Many mental states, because we want to rule out cognitive impairment. And with that, I've come to the end of this very presentation, symptoms and signs of hyperthyroidism, and I've covered entire system in the body. Check it out. The next presentation will be hyperthyroidism treatment, and that will form part 3 of 7. Thanks for listening. Please remember to share. Please remember to subscribe. I appreciate it.